Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And very good morning to all the participants today. And let's say thanks for everyone for coming. So, before I start with the session plans that we're going to go through, my name is Dr Mas Adil, and then this topic about graphic podcast. And then we're going to do this about 4 hours, alright? And then what we're going to learn is there's 3 modules. Starting here, first we're going to learn about introduction of massage, second standard operation procedures, and lastly the component of massage itself. Okay, so a little bit background. So I'm a medical doctor and then graduated from Accreditation Medical College in 2017. And currently I work as a director of Polyclinic. Previously I worked in government in Kesihatan. Last I worked in Klinik Kumang Semang. Then throughout my career I'm also a certified international taekwondo. I'm currently a full-time black belt and I'm teaching now. I'm at about 3 centers. And the next point, I'm a lifelong member of Selangor Sport Massage Association, as to why I'm been granted by the association to conduct this course. And then to be able to conduct the course, I need to have a CAM, Sijil Kemahiran Malaysia, Sijil Sport Massage, then I'm allowed to teach. And lastly, I also a certified licensed taekwondo. Okay, so just next about ice breaking. Okay, so I want to ask: does anyone ever hear about sport massage? So you can have the mic. Okay, anyone know about? First, maybe you have heard.
Cakap.
Yeah, we are allowed to speak in Malay or English.
Oh, okay.
Dua bahasa. Only these 2 language.
Only 2 language. Okay. English and Malay. Assalamualaikum warahmatullahi wabarakatuh. Nama Hafiz. Kenaan sport massage kan? Pernah dengar belum ni? Pernah dengar, tapi tak tahu secara detail apa sebenarnya sport massage. Jadi datang sini kita nak ambil ilmu itulah. Kita tahu dia dengan sports, kita nampak dia sebagai sport. Tapi ada juga dia dengan macam lainnya. Walaupun nama dia sports, tapi dia bukan sepenuhnya untuk sports massage. Kerana yang itulah tak dapat lagi pentauliahan, tak dapat lagi pengkhususan dia daripada siapa-siapa. Jadi yang hari ni kita nak tengok dan nak belajar macam mana sebenarnya sport massage.
Okay, good. Thank you for this. Okay. Because when we heard about massage, the first thing crossing our mind is Thai massage. Alright. The next is traditional massage, or we call Malay massage. And then we have Indian massage. Then the other massage we have become, or then we move the combustion. So then here comes the sport massage. Sport massage is considered as a massage because it's based on adrenaline base, and then we target on the muscles. Today what you're going to learn is all about muscle. Then before I go through again, I need to know some introduction background from 4 of you. Well, maybe you can just tell me your name and your profession background, what you work, what you currently do, and then after this, I will tell you what the career in this sport massage. So maybe you can start from left side. Yeah, ladies, can you give a bit background? Your name, where you stay, and your background, anything.
My name is Zainab.
Okay. Okay. Hi Zainab. Say hi Zainab. Okay.
Hello.
So where do you stay?
I'm staying at Pride, Bandar Pride area.
Oh, yeah. Okay. And then, do you have any background what you do previously?
I was a kindergarten teacher.
Okay. Nice. Okay. Okay, thank you. Okay, then we can have this our lady, beautiful lady here.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Saya Puan Asmani. Okey, saya tinggal di Kedah. Okey, saya freelance sebagai coach taekwondo.
Oh, taekwondo. Stay with me. Wow. So maybe after sport massage you can share experience.
Hello, Assalamualaikum. My name is Muhammad Ridwan. I'm currently working as a property businessman, and I'm joining this course due to my personal situation where I have injuries, and also I have interest in anything medical due to a few of my family members being in that field. Okay, thank you.
Okay, and again, sir, maybe I need to know you more. As your background.
Okay, Assalamualaikum, very good morning. My full name is Abdul Hafiz bin Zamri. You can call me Hafiz.
Alright, so thank you, Sir Hafiz, for your comments. Alright, so again, so before we go to the other slides, so I will again can share your experience, share whatever you know about sport massage. So, Madam Bena, you think good? Okay. Sport. Have you ever massaged your friend, family member?
Responsibility for the athlete. If those athletes got any injury, then can do massage for them.
Alright, so then, do you know why the word comes from the sport massage?
I heard before about what massage, but I want to know sport.
Alright, okay, thank you. Because her answer will be more in detail in our course. And as she says that sport massage for athletes, for those who are doing sport, badminton, taekwondo, marathon, right? Does it true? So does it for anyone? That's the question. Then next, our madam, can you share your experience? Maybe you have experience in massage people.
Okey, akan cakap baiklah. Awak semua Inggeris kan?
Okay.
So, saya ada experience dalam urutan tradisional dan reflexology. So, beza massage sport dengan urutan lain. Massage sport more kepada otot. Okay, tradisional more kepada urat dan saraf yang inilah. So, bagi saya kalau massage sport, kalau di combine semua urutan tu, boleh jadi satu urutan yang feedback yang bagus lah untuk badan kita kalau kita combine all the massage tu lah. Gitu je lah.
Okay. So and then just like you said, the urutan traditional, can you explain what's the full point and it's the difference? So what means traditional, what did you learn? Macam how is the bread or how they have it?
Okay, actually tak banyak perbezaan sebenarnya, cuma cara urutan kita sahaja. Okay, tradisional kita dia lebih dalam. Okay, lebih dalam yang kita, yes. Kalau masa sport kita smooth and soft untuk relaxkan badan kita. Perbezaan tu tak banyak.
And then I said for athletes, for massage, the traditional
is
traditional for all people only lah.
Yes. Sesuai untuk semua lah. Sebab kalau masa sport ni kita mau kepada macam kita nak relax badan kita selepas kita bersukan. kan badan kita push badan tu, kita more relax. Macam tradisional ni kita macam membaiki sebab badan tengah sakit. Kita membaiki part-part yang supaya lebih elok balik lah. Itu saja beza.
So I heard about traditional massage. They have this so-called tekan-tekan. Okay, so we go to again. Any idea, other opinions, or maybe share your friend or whatever. Have you ever massaged people before?
Okay. If you ask me about my experience massaging people, I have few experiences. Most of it is massaging my own family members. Yes, my family members. My friends, my fellow sports friends. Most of them will go to the physiotherapist. We go to sport events, even tournament. Most of the clubs, most of the association will call some physiotherapists from other universities, other physiotherapy association. So when we heard about sport massage, I know few things about it. That's why I come here to learn more about the sport massage. And just now, I heard that you say the minimum wage of sport massage for 1 hour is 100. What happened if we took less than 100? Dr. Mas, that's my question for you, because it's quite intriguing when you say 100 the minimum. Okay, back at it. I want to get the answer.
Okay, so thank you, our service. Like you said, about asking about the market, that's what we call market price. Because now we are selling service to people. So in business we have two type of business. One is real estate. You buy property, you sell. The other one is give service. Whatever service, we can use our own capital flow, or we have product, we drive. So depend how you compete. Lower the price, people come to you, okay. But then people who have been working in this area for many years, so especially because now maybe you might pull their customer to go to your side. Like for example, doctor clinics, Panadol I charge lower, 20 cents for each pill. Yeah, I get a lot of patients. Then we are able to cover my liability overhead because sewa apa boleh kan? Masa still 1 hour. Alright, the next. Yeah, brother, Ridwan.
Can I see?
Inilah. Can. Okay.
From what I understand about sports massage tend to address any kind of difficulty in performance experienced by people who do sports. It could be in form of tightness, it could be in a form of sprains, and sports massage tend to address that issue. And I'm not sure, but I have tennis elbow. And when I was in physiotherapy, they do an electromagnet treatment on my elbow. I'm not sure if that is also included in the sports massage or it's not. But it seems to cover the criteria of addressing the injury or difficulty caused by sports, in which in my case is from weightlifting. So yeah, that's what I understand about sports massage. Yeah, that's it.
Okay, thank you, Ridwan. So, from the discussion that we have, the ice breaking that we had just now, so basically, why there's this kind of sport massage in this field? Again, for example, for in clinic, we need a doctor, a medical doctor, no doctor, no MC certified, sign. Alright, if you have nurse, you have 10 nurses, you have 10 MA, but no doctor, the clinic cannot be run at all. So, same. So what we, after this course, we get the title Sport Masyhur, call it. Alright, so where to put this Sport Masyhur, right? This field, Sport Masyhur is another sub below a bit sport therapist. Okay, when you go to majlis bukan negeri ke apa ke, you all akan nampak dia akan tulis apa pegawai, bukan, and then doctor. Of course dia kena doctor. Doctor is not simple doctor that has a sport medicine background. Ini I only have sport science but not sport medicine. And then they have this physiotherapist, nurses, and then the lowest sport. Okay? There's many answer for that. At least when we have the sport masyhur that everyone can apply for job. Dan semua orang boleh lah. Kan? Ngobrol tu lepas SPM, they don't know where to start and they can learn from start, they can start their degree. So if you want to learn, you want to do physio, you need to be a physiotherapist at least 3 to 4 years. Okay? So that's it. So I would like to proceed to our next slide. Is it okay, Vishu? Alright, thank you. Okay. Short video you can watch. Looks very relaxing, right? Cool. Alright. So next we're gonna have short warm up. So about 2 minutes. Think you all can stand up. You're gonna have a short dance. Okay, just follow what I heard. Have you ever had a penguin dance? Okay. Betul. Okay, nari. From right to left. Okay. Turn left. Okay, back. Left. Pull right. Okay, turn. I'm already sweating. You're almost there. You're almost there. Oh, really? Okay. Okay. Have a sit down. Okay. So, how do you all feel? Alright. So, okay. Okay. At least the reason why I asked you to dance, at least I can know everyone. Usually you don't have any injury, I assume. You have your knee pain, you are able to have your shoulder pain, you cannot be up your shoulder. Alright. Okay, so before I start, these are the learning outcome that you're gonna learn. First one, be able to practice all 4 basic techniques of sport massage. Adequate oil massage applied during a full body massage session on a designated massage bed within 1 hour. It's a very specific learning outcome because you can do whatever type of massage or whatever technique you want. But then the improper technique or improper SOP, so you may not get the fully benefit of the form itself. So why very specific learning outcome. Plus, the reason why I say 1 hour, because yes, at least 1 hour is where you can charge your client. And then full body massage. So anywhere you go to any center class, you need full body massage, require 1 hour. If you go less than 1 hour, you might not get the benefit of the massage itself. So, right, there's many types of oil massage. That's why then we're going to learn what type of massage, oil massage. Second, perform the correct technique of proprioceptive neuromuscular facilitation. Basically, it's a very specific name or very catchy name. Basically, it's just stretching, right? PNF, like stretching. After you do the massage, you need to stretch your client so that they can have the release whatever muscle stress, right? And then I purposely put 20 minutes, at least you're going to learn to know how to get to achieve this 20 minutes. Third, recognize the contraindication and the practice 6 recommended safety and hygiene. So you need to learn what do and don't, and then what are the safety and hygiene, alright? So to avoid any harm to your client. And the good thing is because I have a medical background, so I can share more in these topics, learning outcome. So lastly, able to recognize 15 common anatomy human muscles and diagnose 5 common muscular. This one I think is very new for any one of you, because if somebody asks, "Oh, doctor, I have a frozen shoulder," and how you want to recognize, is it a truly a frozen shoulder or sick frozen shoulder? "Oh, doctor, my knee is there, total tear, ACL tear." How do you want to differentiate? Alright. And lastly, we're going to go through all these 3 major modules, and then these are the sub modules. Alright. So that you know, so we have a sub module. The first module under introduction of sport massage. We have the definition of sport massage. And this to answer back why the different time massage, traditional massage, and why there is a sport massage. Second, under 1.2, benefit of sport massage. 1.3, we have preparation, tools, and medium of use for sport massage. You can hear these are one of the several tools. Okay, we need to have a back massage. Normal massage, basta. That's right. Okay, then we go to standard operation procedure. So, The first one in the indication of sport massage, okay, where we can introduce or we can promote sport massage. How? And second, 2.2, we have contraindication of sport massage. And why they will do and do. Okay? So not all people, not semua boleh. Anda ada. They have to have great line cross. So that, oh bro, sir, we cannot perform sport massage on you. You need to have a medical advice. First, like that. And then 2.3, ethics, safety and hygiene sport massage. Why I emphasize ethics? Because when dealing with people, especially then when we need to have we are doctors, we need to respect patient confidential. Right, when buka tangan dia nampak dah ada tattoo ke apa ke, so kita kena simpan rahsia. Okay, so that's what we call ethics. Safety and hygiene, yes, kita kena penting supaya so that we need to avoid any harm for our client. Lastly, component of sport massage, these are the 5 sub-module that I will emphasize more lah. First, anatomy of women and muscle. This is my forte. I can talk more. Right? And then we have first event. We have a 4 basic technique. If you go to YouTube, you might be confused because when you write sport massage technique, there are many types of technique. But actually, there are only 4. That's why I emphasize basic. Alright? If you see other than these 4 basic, not considered basic, it's considered advanced. Alright? That's now our Ridwan said, well, machine, they will go under advanced. Okay, profile setting neuromuscular sensation, touching, how to touch the muscle. And then lastly, we need to have a classifying relationship form so that we can have, after we massage, the client can just, hey, bye-bye, go, you pay me, you bye-bye, no. You know what things are we can do. And at the earlier, I said, what are the path career for massage. Okay, so we are still in the ice breaking phase. Proceed. So in sport massage, you need to have the level 1 first. Like today you can join the course level 1, and then you need to apply 2 to 3 years to be able to join at the second. We call it advanced massage, sport massage. Alright, available under IKBN, Kuala Langat, or under Selangor Sport Massage Association. After you have these 2 certificates, then you're able to apply for this SKM 3 ke Mayorat 3. You pass this 3, and then you're allowed to conduct course wherever you are. Like what I'm doing. And then, you can generate income from that one. And then you also can be assessor, alright, after by new years of period cost. How do you want to identify? Based on your CJ, your first CJ lah. So today your CJ will be 2065, so 10 years from now, 2035. 2035. Then you are allowed to apply to become the assessor. Means that whoever want to become, to have this pentauliah, certified sport massage, they need to do exam, and you become the assessor. Markah lah. Okay, and that's one of it. The other way, if you join under sport massage, Tugas Selangor, they have events, but mostly at the Kelang Valley area. I mean, whatever events, marathon, big event, carnival, so they will invite, they will share. So if you have time, you can join that to generate income. So far, I don't have any connection. So sometimes questioning, not that this sport massage is not being recognized well enough. So hope they one day come to the Belah Utara, Perak, Kedah, Perlis, Penang. They want a big event, so you can generate income for event. And then the rates nowadays, it depends. Nowadays, you one per event, they will charge you 180 one whole day. 4 hours, 5 hours. Okay. But if you have your own center, these are the rate, the current rate. Whereby full body massage, minimum. If you charge lower than that, it's up to about minimum 100. go. So if you go there, you see center, charge 100. Yes, okay, that's the price, the lowest price right now. More than that, full body massage can be up to maximum 200, 250, 1 hour. And then you have a low. If you separate by lower body, upper body, depends. Okay, so first module, introduction of sport massage. Okay, so simplified, sport massage is a specialized form of massage therapy that focuses on manipulation of the musculoskeletal and of to prevent injuries. So, Madam Honey, you're right. Sport massage focus more on muscles. And then, second, aid in the healing process. Okay, third, enhance the athletic performance. Oh, yeah, of course, the other massage, like Thai massage, also promote the same thing. So, what are the still key points different from the other massage? From here, I just state, because, again, first, focus on the muscle. Second, again, those clients that we target is more on, we call it sport injuries. Like, of course, when you do your kerja komputer, or your class, kita duduk rumah, work from home, you sit down, you do your job, the chances you want to have ankle injury or elbow injury quite low compared to those who are playing badminton. You have a Spanish elbow, golfer elbow injury, Achilles tendon injury. Alright. Nevertheless, when you do a lot of work at home, at office, especially, you're gonna have lower back pain, shoulder back pain. So those still involve muscle. So now, when Zainab said, more of athlete actually, again, for everyone. Okay. So the benefit of foot massage, joint mobility. When we massage the muscle, the ligament, the tendon, become more perfect and you can make it lembut lah. Increase the mobility and range by reducing soft tissue tension. Second, reducing strength. Right now, orang sitting lower back pain because our lower back muscles cramped. Macam-macam. Third, increase the blood circulation. Then you feel refreshed. The fourth, reduce pain. How? Reduce pain? Now, pain, muscle pain, tendon, elbow, and then reduce pain by stimulate the brain to regulate the hormone so-called endorphins. Okay. In reality, the pain is still there. Alright. But then you massage so that your body secretes this hormone so-called endorphins. The pain is gone. But the pain is still there. At least your body can, while you still not pain, till release pain, the body will start recovering. Pain when you take Panadol, bilang sakit lah. No pain. The pain still there, the swelling still there, you can see. But for taking the pain, this pain, take the Panadol, forcefully tell your brain to cut off the pain punya pathway. That's the second thing. Alright. Okay. So first module almost finished. Preparation, tools and medium. Okay. The first picture. Apa ni? Tanya, what's this? Can you read? Okay. Hafiz.
Massage cream.
Cream. Not ice cream, Kalau simply put ice cream on carrying bag, Okay. Madam Hani, what's this? Sabun. Sabun. Soap. We call it massage soap. You get at Shopee. All picture I take from Shopee and Google. Okay, then we have wax. No, wax. Lilin. Lilin pun boleh. Boleh. But not our Mia.
And one of the people is if my hand slide wax, I think that it is a same one.
Yes. Yeah. Wax means lilin lah. But this one already the product come for basically for massage. But any kind of wax can. And then we have massage oil. So today we're going to use this massage oil. Okay, what's the differences between all these? I think we have about fast, medium, and fine, Okay. Actually for wax, when you use wax, dia bagi kasar. Bila kasar, you lagi more friction, lagi tekan, lagi sedap. Okay. Yes. Press sikit, tapi yelah kalau wax dia cepat kering, pakai then kering, pakai balik. Okay. And then so really for those who have allergy, tak boleh pakai oil, mineral ration, cream tak boleh apa. So the last option lah. When the sensitive we call it, eczema, whatever, psoriasis, tak boleh. Okay. And then cream and lotion are the same. Just to make market, like Maggi, Supreme, burger apa? Deluxe, Big Mac, just still a burger. Okay lah, itu you need to have this, right? Okay, well, during the practical session, I will show you how to open from back, open and prepare. Nice color. It's part of project prep. Go. Okay, next. So it's a bit, because you all have I didn't say zero knowledge. It's part of my responsibility to share. So not all bed massage you can buy from Shopee. At least you need to have certain criteria. With durability and stability, the bed size, bed height, and bed surface. Right. So as this katil is the adjustable height, and that katil adjustable. So we adults, our height will not remain like this. So if you are taller, this kind of bed is your chest. So for we don't just be taller than me, I think this one is for him. But they want tinggi ni lah, tak boleh buat apa. So at least for me, senang. And harga ni for Asian lah. Yeah. And of course durability, you can that one I think Shopee bagi tahu lah berapa kilo, 200 kilo, 300 kilo. Okay lah, that one correct. Info lah. And then make sure stability there, make sure ada 4 kaki not 3 kaki Okay. And then the last one, bed surface. This one cantik. Kalau kena minyak dia tak rosak. Ada yang kalau kena minyak rosak jual. Okay. Headwear, armrest, additional. Ini dulu lah. Okay. Ada cara ni is all been tunjuk. Cara buka, 2 cara buka buat solo seorang you alone. Macam mana nak buka? Go. Anggap burger. Ada 2 orang. Aku buka. Okay. Then, but nevertheless, these are the points that you need to focus. 2 factors that need to be concerned: ergonomics, biomechanics. Apa itu beza? What's the difference? Ergonomics and biomechanics. Nah, ada sport science.
Ajar sport science bio itu.
Any idea kan?
Baik bagi apa?
I think it's about the body movement.
Okay.
Yeah. How one cannot.
Okay.
Yeah, to badan tu.
Betul.
Itu. Yeah.
Ergonomics? Okay, correct. Biomechanics is body movement. Ergonomics tak tahu. Ini other than that. Apa yang selain daripada biomechanics? Ya,
Selain body.
like environment, This environment. Katil. Kalau okay. For katil, biomekanik, kalau katil tu rendah, you massage, you tunduk, you sakit. Itu yang tak bagus. This biomekanik. Tapi, ergonomik, tak katil pula. Kalau katil tu tak kuat, tekan-tekan patah. Okay. External factor. Correct. Mana kalau you buat dekat luar, kau ni kalau you buat kat event kat luar, atau kemah hujan, tak bagus lah. So, kena lah, hujan je nak buat. Okay. Leader say, biomechanics, our body movement, other than that, economic. So, kalau orangnya nak buat pandai. Belajar okay.
Yes.
Right. So, module 2, standard operation procedures. Okay. So, I need to be more professionally present. No more jokes. Okay. So, the first one indication and the one contraindication. The word contra means berlawanan. Okay. So, enough. Not only for athlete, those who have this issue can be promoted for massage. Increase coordination, reduce pain, sakit-sakit, neuromuscular breathing, blah 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 blah, eliminate cramp, blood flow, ventilation, edema, specific point, stretching cardio. Ada ni boleh. Okay? Mana tu apalah. Ya, something to remember, those hanya tak boleh. Tak boleh tu, jangan 3 time pun jadi boleh. Okay? Absolute means cancer. Contohlah skin cancer. Ni kena urut lah. Kena tangan you juga kena. Thrombus. What do you mean by thrombus? Ni medical term. Tahu? Tak? Thrombus ni lah. Macam apa? Ya, dalam saluran our bloodstream we have clot. This is our bloodstream. Then this is our cholesterol yang dah tebal. Our cholesterol, our blood flow. Suddenly, the small piece of this cholesterol deposit clot. Masuk to your brain, so your heart attack. That small piece we call thrombus. How to know from our client? Based on fistula, pasti until you have any hypertension, do your hypertension control, not hypertension control, not control. Need have doctor punya advice if you suitable for massage. Kalau doktor kata boleh, baru. Anything happen, you have black and white protect. Not gumpalan darah, it's not darah. Yes, beside than darah. Anything. Anything cholesterol, calcium, uric acid. Atherosclerotic is purely cholesterol lah. Affected tissue. Those yang luka-luka yang dah bernanah ke apa ke jangan lah. Open wound. Main apa. Datuk licoway suddenly play di badminton. Injury wound. Terkeluar patah nampak tulang. Janganlah wound. Harap relative. Infection of the skin. Relative means that you can say yes or you can say no. Atau the grey area. But that is not fully healed. Saya main tu, fully scar. Okey lah, boleh lah ukur. Scar boleh ukur. Skin graft. Graft ni macam dia kalau burn, contohnya hand, dia pernah kena ahli bomba kan. The fireman for this. Play, save people, suddenly hand got burnt. Got scar. Then he do operation, put skin tissue. But that part suddenly pain. He main motor berapa kan, ni sambut tu massage hand. Heal able. Massage lah. The finger. Heal. Itulah maksudnya. Any question in this slide?
We must not. Whatever. That's more
Wish evidence.
do that.
Macam dia, again, you this melanin sometimes cancer you tak nampak. You cannot see him. No, he looked very well, but saya ada leukemia. Cancer, orang tu massage, bruises, then pecah, thing. So, macam ada letak record. You need to show record. Blind white. Kalau tak ada, kat mulutnya, it's not leukemia, rupanya leukemia. Contoh lah.
So you need to sign the
Yeah.
client.
Then, during the client form tu, we need to have all the details. If they not being honest, then at least we have black and white.
For cancer,
Black hidden. Oh, very hidden face. Depends. Very hidden face. Family stroke patient. Yeah. Depends. The stroke patient, they usually stroke patient already fixed. They join this sayonara. That is already. Oh, like that.
but for
Yeah. Depends. Depends. As I said, if stroke patient not severe, mild, the range of motion still okay. Please do. Boleh.
sebab kita rasa skor tu lebih rendah.
Right. Okay. Plastic safety and aging. Ni dah like semua orang tahulah. You need to go through how to cover syllabus. Wash your hands. Then, for each client, you wear the glove. It's advisable, but sometimes even myself, massage, the bare hand is more feel, you know. And you can feel the trigger point. I mean, when you feel the glove, you feel the trigger point. We do stay the same uniform or wear clothes the winter container. Ni masa dia pakai minyak urut tekan tu. Ada dan tuang. Kalau tuang nanti lele-lele kena balik. Nanti look professional. They were quite interesting about you only clean linen, treatment, do not wear sharp object. Kuku ke, pakai cincin ke, kita avoid lah. Each need to be professional and about all the rules and regulations. Need by rules and regulations. I think it's not lah. Jaga do and do tadi kontra application you kena tahu. Client safety. Whatever data that you have, whatever similar stock, you know, when you have a big talk with client, between you and client. Private or whatever scar or whatever tattoo, whatever the patient shy, what other people know. Next. Okay. So we already reached this module 3, component of massage, where this the part where I need to emphasize more. Okay. So anatomy human muscles. Okay. So doctors, these are like I think 1/100 muscle that we need to remember when our school. Okay. So my function here is go to at least you need to memorize or know 10 or 15 major muscles. Okay then. So we go by part. In medical student we learn by part. So head and neck, one part. Okay. So head here we call it frontalis. And dia sakit kepala why? Because this is a so-called muscle named frontalis. Frontal. And front, depan betul. Frontal. And it become this sound like medical doctor. Kenapa lah? And then from here, tepi here is temporalis. Sometimes tak similar but temporal not here. Okay, so doktor katanya, doktor will ask you, sakit mana kepala? So, temporalis. Frontal. So, you already have two muscles. Ini Lebih. Kita. Tapi ya, for massage, we do have facial, but more like spa massage. You learn the first one. Ni more for massage, not for spa massage. But ini semua tu ada masalah. Master. Sudah 3. Then, di mata ni not important. But we call it ocularis. Ocularis. Oculi. Ini mata. Ni kan. Sometimes you also massage. Bulan ni. Bila tengok TV banyak. Minggu banyak kan. Dia sama kan. Sini. What massage is this? It is orbicularis oculi. Okay. So 4 massage. But the important thing yang frontalis temporalis. The other one. Okay, now next we go for next. Next, the most important. You must remember this whole panjang. Tengok dah. Yeah. Sternocleidomastoid. STM. Sternocleidomastoid. Yeah. Why the name sternocleidomastoid? Yeah. You have 2 muscles, 2 heads. One is connected to our sternum, and then one to clavicle, and that's why it's sternum. Then which to our thigh, jantung. It's very important lah. That's the neck, and the other one is upper part of trapezius. So 4 frontalis, temporalis, SCM, and upper trapezius. So if people tanya, head and neck is 4 main major. The other one, okay. Okay, next, upper back. The most important is lower part of trapezius. That I will have to say now. What science?
Yes.
Okay. Deltoid. Deltoid. Deltoid kalau tak tahu, tak tahu. Deltoid. Jadi, mesti lah tahu. Tadi jawab apa dah? 4, 5, 6, 7. Line up. Masih. Muscle. Ni muscle. Bicep. So got 2 head. Yeah. 2 head. Then, here. Tricep. 2 here, 1 here. Okay, 3 head. Okay. Agonist, antagonist. Berkawan rapat. Okay, ni hafalan pun jangan acing hujung hafalan. Kita tahu. Baca tricep. Okay, this one maybe you agak sangat. Ni brachioradialis. This one bila you main motor ke apa ke, atau main golf ke, atau apa benda ke, mancing ke. Macam tu agak sakit sini, betul? Brachioradialis. Dah 7 masa lah. Easy. Depan. Brachioradialis major. Yang dia ada minor. Minor itu ini. Our shoulder consists of 5 muscles. If you say for the shoulder, you have tadi apa? You have what? Shoulder manja. You can work very besar lah. Jadi under shoulder, when you say shoulder, not only deltoid, 5 major muscles. First deltoid. Deltoid saja ada anterior, medial and posterior. You need to massage, cover that one. Pectoralis major part of the shoulder. Kena massage juga, lembutkan your pectoralis major so that your shoulder become more better. And then it's not major, pectoralis minor. Major dia sangkut sini, dia tak sangkut shoulder. Tapi pectoralis minor ada our shoulder, our scapula. Scapula kita panggil apa? Belakang. Tulang belikat. Okay, bayangkan ni scapula lah. Atas supraspinatus. Narrow tepi ni kita panggil infraspinatus. Dalam ni kita panggil subscapularis. Belah kiri. So ada otot sini. Jadi practically dia ayat tunjuk terus ni sub ke supra, atas supra. Bawah sini infra, bawah sini kalau kita tarik dia subcapillary. So ni semua cantum ke shoulder. So 3 plus 1 plus 2 all 5 marks. Urut tu baru you can maximize recovery for your shoulder manager. Theoretically, kalau tak pandai buat pun tak dapat. Okay, so dah berapa banyak masa dah? Dah 10 dah. Apa banyak? Betul. Okay, then we go. Ini tak perut tak digalakkan massage lah. Advice to massage. Unless produce and the name is rectus abdominis. Nah, traditional allow, but for massage is not.
Kalau domain kalau dia tepi kan, dia masuk dalam.
So it's not absolute, not advisable, not relative. You can massage, akan tetapi jalan because aku mengatakan aku massage evidence based. So I think because kurang study on the perut, lepas tu dia orang tak berani cakap boleh. That's why sebab massage tak juga lah. Sebab dia pun
special.
ya, traditional ni tak ada evidence based dia buat lah. So the justification because of that lah evidence based. Sebab masa tak fokus ni. So kalau ada kajian banyak, kalau memang terbukti, baru dia orang makan je. Okay, next. Awal ni apa? Ya. Quadricep. Katakan hamstring. Quadricep. Why is it for muscle lah? Rectus medialis. Rectus femoris. Rectus lateralis. Ada satu lagi. Ada 4 nama. Ya, nama dia saja. Ada 4 muscle. Sebab tu namanya quadricep. Belakang hamstring ada 2 nama. Here bawah, here gastrocnemius. Gastrocnemius is superficial muscle. Bawah dia soleus. So potent is this 2 muscle. This big muscle quadricep. Ini already 4 dah 15 lah. Okay, so type of muscle movement, whose cardiac skeletal. Yeah, our focus on the skeletal muscle. Okay, kat ni. I said, whose muscle, perut. We cannot massage whose muscle. Whose muscle, apabila dia buat dari sini bahasa muscle, itu voluntary control. Perut akan sentiasa bergerak. Regardless buat apa. Perut tak punya, perut. Tak boleh halang. Otak boleh halang. Cardiac tissue, kita mati pun di depan mereka. Alright. The only muscle we control is skeletal muscle. Okay lah. For this finish, lymphatic system. These are the one yang paling differentiate compared to traditional or whatever massage apa. For massage because we have evidence based. The among all 4 techniques ada drainage punya massage. Itu kelebihan dia. Kalau video tadi you hanya nampak tadi tekan dia buka. Dia tolak to all the lymphatic point. Okay. So why this is important? They are the organs that control immune system and this di mana kita tolong lawan virus, bacteria or insect. So here kan, misal doktor akan check selalu. Okay, kalau check darah dia want check if there any infected lymph node. From here, setiap 4 tepat, 1, 2, 3 and 4. Ada banyak lagi. Ini border lah apalah. Ini paling major, ni 1 lah. Ini 1, 2, 3, 4. So kalau 1 pergi ke, if you go to any massage, traditional massage ke apa ke, ending tu They just let you go like that. Not fine. Tapi suddenly that muscle, dia massage tolak toward to your tolak tu. Kalau head and neck ni lah yang urut dia punya tulang ni tolak balik ke atas. From atas tolak ke bawah. Kick ke whatever the from here tolak sini, from here naik atas, from here tolak ke bawah pun boleh. Make you know about elevated drainage. Consider. Okay, infection, any problem, autoimmune, cancer. So, these are part of the contraindication lah. Kalau infected tissue, infected lymph node. Got infection, suddenly buka swelling, infection ke, ada mata telinga ke apa ke, habis jangan urut lah. Because you cannot drain out the whatever waste product from the muscle, from the kilang ataupun the sampah itself dah affected. Boleh dah elok baru boleh urut. Sama lah kalau cancer ke apa ke. Betul tak? Okay, next, pre-event and post-event. So, ni paling penting. So, before I proceed, tanya Zainab. Massage before or after? You use spot. What do you think? Okay. Anyway, can. Yeah, it's okay. Kami? Okay, it's any different. Pre and post. Not many different. Okay. It's
Very different.
many different. Many different. Baik. So much different.
Kalau report tu tak dia bawa kereta, tapi dia buat kereta dia orang sama. Tapi saya tak ada betul report yang after report. Dia disebutkan dia semua dia takkan kuat. Dan dia semacam aduh.
Dia dah tu.
Dia dah nak too much lah.
Tak penat lagi tu.
Tapi lepas tu yang baru.
Okay, kalau free dia nak check ada problem.
One of it. Second, contoh lah. Contoh, dia actually dia tak cukup masa nak warm up. Dia hanya jadi mini je. Tak ada warm up, cek tak boleh. Tapi by doing massage, masa tu tolong buat. Kena tolong stress. Tu semua kan. Tu kerjanya lah. Tu time ni je. 10 to 15 minit je. Kan? Dia lari marathon ke apa. Yeah, part of the work. And then minimum oil bani paling soalan. Okay. You dalam ni mengatakan if you letak minyak siap-siap kat badan you, so you baru kurang keluarkan haba kalau perlu sebabkan energi simpan dalam badan. So you ada tenaga lebih. Ayat ni lah. The minimal use of oil because it can clog pore and make it difficult for that spread so that you have a lot of energy. This syllabus from the Satuan lah. This slide from the Satuan, so we need to follow. Pay attention to it. Tadi buat kata tadi. Attention ni kan. Okay, pernah. Okay, help reduce muscle for we have post event. Post event bila dah already wear and tear, pakai all the muscles ni how we are suddenly if you suddenly go rest, usually apa akan jadi? Cramp. Because the accumulation of the lactic acid or the waste product of the muscle not really well distributed out to the linear drainage. So these are more important. Kalau pre-event tak buat, it's okay, but post-event is more important. And then by right, kira-kira 30 minutes within that. After cakap habis lawan, 30 minutes. It didn't show in the TV, but all our athletes, especially that badminton, I was told during the sport science, usually lepas habis event, kalau menang nangis-nangis hura-hura, you need to go and makan. the first 30 minutes in sports science, up to 1 hour then maximum. Kena makan protein, more protein to get back their recovery. And then flash. Kat sini tinggi lah. But that one, after that, can go wherever you want. That's the crucial period. You miss that one, you tersejuk. Actually better all three mah. During that 30 minutes, really those high performance athletes that tak kram. But those that are not, we are conditioning like not even 30 minutes pun dah kram. We are talking about high performance athletes. I think our athletes, me assuming they are already high performance, not this kind of athlete play. Okay, so any single cramp, perform more than 1 month. Okay, ni pun satu point. Kalau kaki saya cramp, boleh massage. Tapi kalau satu badan cramp, maybe dia peluh, bagi air dulu. Atau plus, atau apa ke, ini baru boleh. Kalau you massage saja, air tak ada, tak boleh. Okay. You almost finish. So, Wan, 5 minit sudah sampai. Wajah. Aku nak tahu, kena buat massage. Tak ada fast lah. Okay. Okay, so, now we are at 3.3 sub-modules for basic technique for massage. Okay, so good thing is from idea or learning outcome, I said these are for the full body massage. Meanwhile, within 1 hour, so 12 minutes, 20 minutes, plus 8 minutes, plus 20 minutes, you will get 1 hour, 60 minutes, 20, plus 8 for 20, so 20, 1 hour, 60 minutes. Okay, mathematics. Okay. So the first one, we have éclairage. It came from French language. Éclairage. There is no other name for it. Right? You can call wherever you want.
Tanya juga.
For beginners, they will say what? Al-Faras. You want it? So, you're in Faras. Or married. Or not married, so can answer, huh? So, sound not very good. Oh, okay, Al-Faras. Good. Yeah, okay. So right and left. Kalau upper back, kita buat atas dulu. Subside 3 minit. Sudah 6, 12. 3. Tu 3 dalam 4. Betul. So kiri, atas kan badan. Buat 3 minit. How to get that 3 minit? Sekali tolak, consider 5 saat. Okay. So 5 saat. Nak buat 1 minit apa? Apa suruh? 8. So buat 8 1 minit. So kena buat dalam 3 minit, dalam 3 lagi 30 kali. 1 minit. Tok. Seman 30. Tukar pula 30, 60 dapat 3 minit. Tembak kaki pula. Contohlah, that's how we get 12 minutes. But if you're professional enough, you can keep all this one. You can automatic. Kita panggil muscle memories. Okay. First, simply means that warm up. Apa? Line up. Hidran. Hafiz and Hani. Warm up so that our body is okay. Massage. Really? Okay. I'm ready. Okay, next. After warm up, we go for kneading. If you go for YouTube, there's the name for it. We call it Swedish. Swedish massage. Swedish. Same, Swedish massage. You lift up the muscle, you tubate. My understanding is you induce injuries. Contoh, the muscle already tight and you want to release it, so you need to let go, sandal the muscle. Okay. Now it become like this. Whereas the muscle tight betul, you don't. So you warm up kat dia, kau berkecut, dia dah kembang. And then you do the kneading, dia become terbuka lah, terurai. Tapi dia tak sambung lagi. Then there's some cross fiber. Cross balik. Ni baru dia sentuh balik. And then last one, drainage. All the waste product yang keluar, push up to the lymph tip. The lymph drainage lah, atas ke bawah ke, according to wherever. These are the arrows. Advice. Okay. For leg, you follow sampai ke atas. But then, logically, from Johor to Perlis, the car will die lah. You're on high, even the kereta EV pun tak tahan. So basically, kalau kaki sampai sini dulu cukup lah. Got station by station. Okay, understood? Okay, ni teori je. Okay, ni one syllabus from the start one. In Malay, convert to English by Google Translate. So if the grammar like kucing is kucing punya, di Google punya. So this technique, first step, right? Gentle gliding movement, like I like Rudolph punya ni, bunga. So help to warm the tissue. Kneading is we call it using a pump to release the muscle to increase activity and stimulate blood flow. So apa saya cakap tadi dah. Faster. After completing the kneading technique, third technique, muscle relaxation technique. Okay, to reduce this tissue movement. Contoh balik, dia boleh climb. Lastly, drainage to accelerate blood flow to balik waste tissue. Okay. After 1 hour of full body massage, we need to complete with PNF. Sinilah where you tadi kata maybe lah 100 for 1 hour, but then if the client really know what spot massage is, whether the 100 massage include this PNF. Setengah orang dia tak buat PNF. Kena PNF kena bayar. Dia buat package macam tu pula. Dia package sendiri lah dekat rumah. There's two type of massage stretching dan active, passive. Active means that we do ourselves. But the problem is sometimes if we are still in pain, we cannot do full range motion. Ingat satu shoulder pain. Okay, so we need to other spot muscle to okay. We call passive stretching. Okay, kena buat dua-dua. Better we practice. So the range motion improve the motor performance and tak ada PNF, maybe your shoulder balik rumah je tetap balik. Because dia still ada screw yang tak tighten. Again, this is all theory. So PNF, we have 3 main technique: hold and relax. Okay. For example, for this limb, my right hand, the quad muscle will tarik. Dia akan tarik, you relax je. And she will maintain kira 1 to 10 seconds and relax. Relax balik. Contract and relax, bagaimana? Those muscles that have partners like bicep, tricep, quadricep, hamstring, posterior and tibialis, so dia ada kawan. Bila kita contract bicep, actually, this one now which muscle contract? Tricep. Extend, extend, tarik. Then kita nak dia contract pula, we flex, bicep, contract, tricep relax. Agonist contract, sama jugalah. Cuma ini lawan. Again, contoh ada squat massage. Kita tarik, okay, abang cuba lawan saya, dia tarik sini, tapi kita tarik balik lawan. Tu panggil agonist. Okay, this is a short video. So dia. So this first standing for KNF. But the client relax je, tak apa-apa pun, jangan lawan. Do all the job is just what. Dia angkat sampai tahap tu, he lift up the leg until that angle, the client still okay. If the client feel kata boleh taruh lagi, taruh lagi sampai atas, sampai dia rasa tegang, boleh lagi. Dia kira 1 to 10, then dia up lagi, nampak. Dia tekan sini ya, supaya muscle. Wow. Dia nak fokus sini. Tekan ini untuk sini. So dia tekan sini supaya ini tegang. Ya, relax sekarang ini. Okay, last before we end. Okay, special note. Kenapa, why we do stretching, actually for those taekwondo, very famous to do the splits. Suddenly you feel like, tak boleh, we cannot go further anymore, naturally. Because our brain already set the so-called Golgi tendon organ, the nerve center. Oh, enough. Okay, if you go beyond that, the muscle is koyak. And why our, like, for example, my 3 years old girl can flex. Nothing. Because first the muscle is still soft, and then it's Golgi receptor in small kids. So but actually they are stretching. Kalau they do oftenly boleh koyak. Finally the child will refuse to walk. It's pain. Child will complain, but we adult, so obvious. Okay. Alright. Okay. So client evaluation. Have a short one for after sport session. It's possible to obtain the client evaluation feedback via form, and then for the maintain sport with client as a reflector tool regarding our performance. So this part of the module. So what are the points they need to be inside the evaluation form is apa yang perlu ada dalam form tu, adakah baik ke tak. One of it is the best is before we start massage we assess first, and then after massage. Contoh like you have a shoulder pain, dia tak boleh angkat sini kan, this is pre-massage. So we record that berapa degree, 20 degree, 50, if consider 90 degree lah. This 180. Okay, then we have record. So after massage, the client boleh angkat full. Ini 100, almost not 100%, but it's almost achieve fully recovery. So, kita tengok macam ni, pun macam tu juga. We need to record down. So maybe tak cover. Ini ada cover. Sambung lagi. Offer, pakcik boleh bayar lagi tak? Contoh. The pre and post. Second, yang perlu ada is feedback. Yalah, kita tekan sakit. Semua orang different pain threshold, so that we know, this client is type of client macam ni. Start client, so then we already massage 10 to 20 or 100, kita dah tahu dah. We have vast experience. 3, apa yang benda kita buat di petas sekolah. Ni we need to know. Contohlah kita suka pakai ni ke tak pakai ni. There's ada form that you do lah. Ada than that, part of their industry lah. Yang dia
Sebelum
two form. Correct. Okay. Kena belajar. We just finished our practical session, and then we're going to go through the summary, review outcome, and then we'll end our session. So we are already around 1 o'clock plus. Okay, so summary again, we go through back. So we already covered three main module. First, structure of spot massage, then the procedure, and the last one, component of spot massage. Alright, so I think the last thing I did touch is we call it muscular disorder. I'm just going to share you 5 examples how to diagnose. Like it's now at the beginning of the session. Frozen shoulder. The definition of frozen shoulder is the fixation or fixed range of motion of the shoulder. That's it. So you need to know the beginning of the shoulder. Range motion from 0 is angle of 0. It can even up to more than 150. This 150, 180, and maybe more 100. 90 to 200 degrees. Right, it's 90 plus 90 and 10 go. Which is normal range. Okay, for healthy adult people, it's normal range. Definition of frozen shoulder, they can't even 0, they can't even go to 180. So among this range, these are the definition of frozen shoulder. For people for this true frozen shoulder will come like this. Kalau macam ni, sudah kosong, dan dia tak boleh angkat. Nombor 2, fix. Kalau boleh cannot macam ni, maybe not true for the shoulder sangat pun, for the shoulder tapi not severe. Kalau severe for the shoulder macam tu je. Ataupun dia dah tak boleh nak go back to the original, itu sikit je. Itu frozen memang. Ataupun nama lain dia adalah adhesive subcapularis. Itu nama medical term. Adhesive subcapularis. Okay, to treat it again, spot massage, you need to know where it will stand. If you go to severe, this normally happen in a stroke patient, you cannot make massage until it become whoa. But if you see there's chances, okay, so you might help it to improve the range of motion. Besides frozen shoulder, you need to know, we call it, apa, ini rotator cuff injury, correct? Rotator cuff injury is different, not frozen shoulder. Rotator cuff injury, frozen shoulder dia gerak tak sakit dah. Usually dia fix saja. Usually dia dah terbiasa dengan sakit tu, tak sakit sangat. Tapi macam tu lah, dia tak boleh penuh, dia tak boleh penuh. Rotator cuff very painful. So you can differentiate. It might be overlap, but rotator cuff can fully recover. That's different, right? So rotator cuff, asal the patient sakit tu memang 1 to 5, 1 to 10, you bagi 5, 6, 7. For the shoulder, 1, 2, 3, jadi dah minit. So shoulder cuff very painful. Jadi siapa yang weightlifting so this one of it, I agree with you, rotator cuff very one of the common. And then kalau lower back, common lah, lower back. Kita panggil lower back pain. Usually there are many types of lower back pain. So usually here we have psoas muscle. Alright, you can Google up. So psoas injury, psoas spasm. That one, there's other one. So it's from here. It's from our iliac, our pelvic, and it's touch the spine. So ini PSOAS, psoas muscle, silent P. PSOAS. Psoas spasm ke, psoas injury ke. It's apa? Psoas muscle. Itulah, bila jangka berat, sakit. There's the muscle. That one is considered deep muscle juga. So, below the quadratus lumborum. So, you tahu tu, kita target situ. And then commonly also, kita panggil tennis and elbow. Tennis and golfer. Jadi melibatkan twisting lah. Dekat mana? Dalam ke luar? Okay. Luar is kita panggil tenis lah. Tenis, orang main tenis tenis dia akan sini, so sini sakit. Dalam sakit, kita panggil golf. Sebab golf, dia dalam ni pakai banyak. Sebab dia rather than outside di sini. Golf and tennis elbow, cara urut dia, fokus lah dekat situ. Tarik, masuk ke atas, tarik, masuk ke atas. Lembutkan balik the muscle yang tight, bicep, tricep, trapezius. Okay. Is there any other injury that you want to know? Tak benar. Tight cough, nama lain dia. Dia apa? And there's no specific name for that. Tight cough is tight cough lah. I don't know. Okay. Okay, next. Okay, next we go for our review outcome. I can name 4 questions. We have 4 people up here. So, okay, wait among these 4 questions, I gonna I'm gonna spin this bottle. Oh, oh, Hafiz. First question.
Yeah.
For
best sport such.
The wish need to be recognized. Okay.
Name only,
Name.
Name for basic techniques of sport such.
Can you explain?
Explain a bit. Okay. First of all, the first is a full rush, where you rub under body rub on the muscle you want to massage to open the the blood capillary. So make it warm, make it warm, make it look a bit red. Then you can start under massage the rush. Next is the kneading, where you knead the muscle to make a small toe on the muscle. So when you go on, knead the muscle, it will send some signal or some information to your brain, where this place needs recovery. So after kneading, you have to do the cross fiber. Okay, cross fiber is when you massage the muscle opposite the direction of the muscles to straighten up the muscle after you make a toe in muscle from the kneading. The last is drainage, where you push all the unnecessary things, acyclic, waste product, acyclic from the body to the lymph nodes, whether it's here, I don't know, lots of part. Here also, between your legs also. I swear, there's the 4 techniques of the massage. That's all for me. Okay, thank you.
Okay, good. So just to cross same as cross fiber.
Oh no.
So in advance, you want to continue testing dry needling, myofascial release, spot tapping. Maybe you see our badminton wearing all the colourful tapping, gonna learn in advance. Pakai the kinesiotic stick.
Oh, acupuncture.
Dry needle. Called dry needle.
Oh, consider that.
Dry needle because only focus on the muscle. You punch, poke into the nerve, become acupuncture. You only play within the muscle layer, called dry needle. Same. But the point are different. Okay. So then the last one is trigger point. Trigger point that I told you, Shine, the practical. And you play with the trigger point. You got once, even myself, I'm not mastered yet. So you really need to know where the specifically anatomically. If you ask me, doctor, yeah, I can say original, essential, blah 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 blah. But then where it's totally, because different people have different positions. And so really experience. Okay, next. Yeah. Okay, so it's focus. It's back to office means backward. Okay. It's well recorded. Mana pas kontak kita.
Ni, boy.
Yalah, ni. Di sana. Contraindication of spot massage. When you don't or not allow or try to avoid which type of clients. Okay, give any logic answer. Yang tak boleh urus macam-macam. Apa lagi? Which one? Example. Okay. Explain a bit why. Why cancer we try to avoid. Kalau orang tanya,
for sure then why I have to
skin cancer, why can I massage? Am I that bad enough? I saw very communicable, dangerous. I should quarantine. Okay, cancer cannot avoid because we might exaggerate the or activate. Now, you have leukemia or you have a skin cancer, you massage, then the cancer become more aggravated. Lagi bahaya. From stage 1 to stage 2, stage 3, stage 4, you trigger it. So, by right, you need document from doctor say that patient undergo chemotherapy or fully black and white say that he's fully recovered from the cancer. You are saying she or okay. Okay, next, number 2. Cancer, what are the contradiction?
Insect. Sure.
Okay, next. What other than cancer? The other 2 contradiction. To me, it's under cancer. Next. You have infection, especially skin infection. You know, you have a cellulitis or any abscess, rabies, or chickenpox. You want to help your client. So your client free from skin infection. Then you can massage he or her. Him or her. Okay, last one. Contradiction. How about rash on the skin infected? And that, have you heard vein? Vein, varicose vein. In severe varicose vein, then we try to avoid. You know varicose vein? Nah, I have varicose vein. Tiba-tiba. But it's very torture. There are some clients very torture, very big. This size, if you they ruptured, it be bleeding and die. Have you ever heard varicose vein? No. Okay, let's take it down. No. Varicose vein definition is your vein, baik ini saluran darah, saluran buluh. Tapi vein dia ada valve. Dia ada valve. Macam tu. Valve. So, contoh, mereka kaki naik ke atas, so the flow will go up, and darah kaki nak naik ke jantung balik, betul? Bila kita urut, dia naik atas. Tapi, normally like this, standing, you cannot go back to bawah balik. Because ada valve ni. Dia buka, stop. So then the vein tak, tapi if we urut, we are forced untuk dia buka. Tak apalah. So in varicose vein, the valve is rosak already. Sama ada keras ke, dia harden ke apa ke, keras ke, ataupun dah tak boleh nak buka dah. So, kita urut naik atas boleh, tapi we tolak bawah tadi we tolak ke bawah, lawan arus dia increase the pressure. Usually kalau vein tu macam my vein tak turun lagi. Kalau dia macam tu, you can google. Kalau macam tu ketul-ketul orang nampak urat tu macam ni kan. Macam tu kan. Maksud dia boleh tahu lah, itulah tempat valve dia yang rosak. Itu varicose vein, severe varicose vein. Okay. Dah ada.
Mana muka memang tak tahu.
Ya.
Tak ada. Polisi yang tak.
Ridwan. Okay. Kahani kan bagi nombor these 3 examples, but ini explain. They're different. We have 30 minutes.
Oil.
What oil? Fish oil?
Oil. Lotion.
Oil.
Cooking oil?
Oil. Untuk soal, kita ada beberapa option yang kita boleh guna. Okay, banyak sampel yang minyak untuk urutan. Okay, walau macam matahari Dan untuk lotion pun ada, tapi kita tak sure sangat sebab lotion tu dia cepat kering. Dia akan sakitkan patient tu atau customer kita. Okay, lepas tu untuk wax ataupun gel pun sama, boleh guna, tapi kita tak sure sangatlah benda tu sebab dia boleh kesatkan. So yang suitable ialah untuk minyak lah. Itu saja. Terima kasih.
So, in exam, satuan Selangor, as long the medium lubricant. Lubricant cair. Medium cair boleh. Okay, and the last four, semua you all jawab together. Okay, which one should bagi 2 masa? Redan, the first 2 masa, let you know.
Dia tak minta.
Boleh. Baca tu dia. Okay. Pas. Ya.
Tadi tulis meja dengan tulis. Convex lumbrous. Ya, dengan trapezius.
Zainab. Kita baca je. Siap betul ni. Nabi, je. Cak.
Mindset.
Next.
Concept.
Left.
Cat.
Dot.
Set.
Kani.
Constant.
Kani pula.
Water.
Ada.
Yeah.
No. Anatomy, muscle. Dah. Okay. Habis dah. Olive. Okay. So my turn. Western osteoarthritis and gastrodynia. Okay. Kita sudah 12. Sambung lagi. Lagi 2. Obliques. Okay, Aziz. Lagi.
Pectoralis minor.
Tak sebut ni.
Deltoid.
Tak sebut ni. Okay. Enak. Betul. Extensor. Ini way is it or not? No. Extensor digitorium. Flexor. Extensor. Digitorium. Jari. Longus. Inilah. Sini. Jari. Flexor digitorium lipat. Kalau ni atas, extend. So, dia belah atas. Kalau bawah, flexor. Okay. Next.
Abdomen.
Pegang.
Ada tak? Ya.
Ada. Okay. Sekarang ni, Syed, lagi 2. You transfer ni. No. Bagi dia sebut. Baca je apa itu. Internal. Sama lah. Oblique tu ada external, internal. Tak boleh. Tensor fasa. Sini. Yes. Okay, next. Hamstring tak tahu apa. Hamstring, quadriceps. Ini ada major muscle. Bukan main umur dia tadi. Anterior tibialis. Tadi disebut tibialis ada consider. Dua-dua posterior. Okay, last 5 common musculoskeletal. 5 penyakit otot yang boleh tahu? Okay. Semua shoulder je. Shoulder pun dah banyak. Oh. IP? Itu banyak di mana tu? IP. Oh, sini. Oh, deh. Sini. AJTB band. Tendon, ligament. Ligament ini je boleh. Saya tak boleh urut lah. Saya kena cross-cut. Kalau ke tanah je. Ni. Carpal tunnel ini cubital. Cubital syndrome. Ini. Sini. Senocular muscle. Tengkok. Okay. So we would like to have before we last Q&A. We start with Q&A first lah. And this open to the floor. Any random questions I want to answer, good. If not, I also. Okay, right now. I have a question regarding sport massage. Only, don't talk about anything more to add. Otherwise, we doing this podcast. Are there any questions? It's okay. You first.
It's simple. I don't know the it's simple. Okay. It's about the pressure of our hand when we massage the person.
The pressure.
The temperature.
Oh.
Yeah. The temperature of our hand when we massage our blood pressure. Temperature. Just now when we do the practical, I noticed that some of us, the hand is cool.
And you are cold. And you're cold.
So which was better? You must have a cool hand or warm it first before you massage.
That one first. Rule number one thumb is your client or your patient. That's the most important thing. So of course, you massage, you want to have a warm environment. So we as sport masseur, before we want to massage, we already rub our hand, and then we shouldn't rule out so that our aircon, our environment is quite cold. So always having rub. I think to answer the question, warm is much better compared to cold because throughout the process, both our hand and the body of our client to achieve the blood flow. That's our target. If cold, we induce vasoconstriction. So we decline the receipt of the sport. Again, advanced level, I say much pressure release before you start. So if you see those are otai, the senior formation before they start and they just need to put. Then the body become and the body. What I mean by myofascial release is the reason one of the reason why our muscle tight. Imagine the orange. We have the kulit. If the kulit ketat, the isi also right. So you need to buka the kulit so the orange kembang balik. So same. Why our bicep become this bentuk? Why dia tak jadi bentuk lain? U-shape. So if your mind become U-shape, I lari lah. Bila it's already designed ataupun dia dah ada kulit dia sendiri. The kulit we call fascia lah. The fascia if terlalu ketat ataupun melekat to the muscle, so how can the muscle glide ataupun release kan? So this is one reason is the physiotherapy dia orang pakai alat kan, hot apa lah, the same concept Attack pempek je. So the form become dia relax lah. Mean the rib dan fascia buka. Sebab kita boleh urut. Increase ataupun synergistically the benefit of sport massage. Okay. Banyak soalan jawapan.
Okay, kalau seseorang dia ataupun okay. Kalau kita boleh tak menggunakan sport massage untuk tu ataupun ada option lain yang sebagai sport massage untuk bagi dia option cara lain.
Okay, kita touch this topic massage. Tapi in the sport massage topic dia ada level 2, level 3. Kita panggil first aid. Under first aid, yalah, is the macam tadi twisted ataupun ni ke play on ke apa ke, ankle sprain ke apa ke, bayar tak boleh urut on the spot. You need to apply rise, rest, incline, curl and elevate. Pernah dengar? Itu dulu. That the swelling subside, then the pain reduce, baru boleh urut. So kita mention inside the contraindication, but it's not absolute, but relative lah. Sakit kena biar sakit reda dulu lah. So within 24 hours habis jangan urut. After that baru boleh 24 to 48 hours, depend situation. Different compared to yang tidak berguna, tu boleh urut immediate, but there's no injury. Second, when you happen, you need to rub and suspect of fracture. To detect how to fracture, hanya paling common 3 things. Fracture kalau bruises, bleeding, swelling terlalu obvious besar dan tak boleh pijak. Contoh kalau ankle tak boleh pijak lah. Kalau tangan, jari tak boleh bengkok langsung. So, bengkok, biru dah jadi biru dah, tak boleh bengkok langsung. Itu fracture. Kena buat x-ray dulu. Kalau confirm fracture, then by right 2 to 3 days dah subside, swelling baru boleh urut. So don't tolak je patient klien tu, explain kindly, seek for medical advice, do x-ray first, mastectomy, do a safe. Okay, I answer you. Okay, you already about 15 minutes plus, so we need to do the feedback. We need to record. Okay, very simple feedback. Okay, so I can have feedback. Thank you. Okay, so we're gonna have a feedback. Feedback 1 point, 1 good, 1 bad, and 1 good. It can be try to be different. To talk about the slide, talk about the environment, talk about the speaker, comment on the facility or the food, everything. Okay, so 3, we're gonna have about 12. Okay, start with Kahani.
Secara keseluruhan.
Jawab.
Okay, secara keseluruhan good, tak membosankan, happening. Okay, cuma dia kalau boleh dia kena macam mana tau, suara kena kuat lagi. Okay, yang tu je. Hak lain semua okey. Sebab kita kenal Dr Mas Adil macam mana.
I have a lot of things to comment. Kipas, aircon, meja, cabin crew dah.
So overall, I see it's quite interesting. Sorry. This time.
How about the food?
The food is delicious, very delicious. It's nice.
The only comment that to improve that is up. Maybe salty or maybe quite cramped. How about the plate?
I have one question to ask. Is it adjustable when we twin the person? Can we use the
Oh. Yeah, I have seen that, but it does not cover inside the spot massage. If people ask or you try ask from where you get it, don't say my name. Don't spoil the spot massage, the beauty of spot massage. But Thai massage, I did. Maybe any other type of massage using food. So I didn't say wrong, but it's not the spot massage. Okay. Yeah.
Okay, feedback.
Good, bad, good.
Good, bad, good. Okay. The first one, I like the surrounding, the place, surrounding of the meeting for the course. Because we have a conditioning, also the fan, the lighting is also good. For the surroundings, it's good. Surrounding is good. Environment is very good. When you have friends that keep answering questions, so it's not I'm not bored throughout the event. The second one, is about the bad. It's not bad. I think we need to improve. Regarding the imaging, I think the design of the simple presentation. I think it's too simple. I think maybe next time I have to interactive is another thing. I think more AI is too much of that. Okay, I think more details. Maybe put some more pictures of muscles. More labelings. When I saw the slide, I see like black and white. Okay, it's black and white. Okay, so my first impression on the slide is a bit. I think something needs to be improved. So the bad. It's not bad. It's not that bad. Okay, just need to be improved. The last one. Yeah, quite like how you present. It's quite cheerful. It's not boring to me, and that's one of your good points. Okay, Doctor. That's all.
Okay. Personally, I don't see any real problem. What I like about this course is the practical. I like the practical sessions. Someone loved it. And then what I dislike is there's not much to dislike. I just wish that there would be more details. I would like it for there to be more details about the sports massage. And then for improvements, I think presentation skills. Presentation skills can be improved, and that's it.
So I hope be able to learn, gain new knowledge of sport massage. Thank all of you for coming from beginning of class courses and be able to end the class. Hopefully, next we will keep in touch and then get any event regarding sport massage. I will keep in touch with all of you. We have a specific group for all this level 1 sport massage. Hopefully next year we will ask Selangor sport massage at 4 of you so that whatever event throughout the nation, we can go there to have some experience. Last one, okay, so that's it. With that, I would like to end our course. Thank you. Okay.